Like most pediatricians, Sanghamitra Misra will tell you that tears are part of the job. These families are lined up to see a doctor in the parking lot of an elementary school near downtown Houston.
The concept of the mobile clinic has really expanded over the last 5 or 10 years. Everyone is thinking of how can we actually get to the families that need help, and it just makes sense.
Many parents are bringing their children for a regular checkup. For some schools in the district, 30 to 40% of students are behind on their shots.
We have very open arms and we're ready to really help the families that need our services.
This mobile health clinic is headed out to that particular neighborhood very much by design.
My interest was in optimizing. I'm a health economist, so I like to optimize resources.
With support from the National Science Foundation, Rigoberto Delgado at the University of Texas Health Science Center, Houston, wants to help providers like Texas Children's Hospital target their limited resources where they can do the most good.
Dr. Misra is busy concentrating on her patients. She has no time to look at whether she's going to the right places or not. We're trying to complement her services by providing the basis for an objective deployment of our resources.
From a data computation standpoint, it's a challenging task. His team is mining previously untapped public health data sets to figure out where to best deploy the mobile clinics, connecting the dots in a way that's never been done before. They use geospatial mapping science and predictive analytics to forecast areas of highest risk for outbreaks. Then they overlay maps. This one shows in red where the fleet of mobile health clinics routinely visits.
But you can see there's pockets here where it needs to cover more. Not that they're doing a bad job, but they might need more resources or deploy their resources in a different manner.
Delgado sees an opportunity. With so much information in the public domain, we should think creatively about new ways to put it to work.
Okay, come.
The goal is to figure out not just where to send the trucks, but also how much money can be saved by preventing illness in the first place.
It's a way of saving money to all of us eventually by preventing bad conditions from becoming worse and having to be dealt with at the emergency room.
Right now, the mobile clinics generally go to schools, but Delgado says this is just the beginning. They're looking at other sites in the community too.
The great challenge is finding out where the next groups of population will get sick. Not 2 weeks from now, but 2 or 4 months down the road, so we can go and prevent that with plenty of time.
Dr. Misra says she welcomes a more numbers-based approach to deciding on locations.
Some days we show up, there's 75 children. Some days we show up, there's 5. And so I think this would normalize it a little bit if we knew that there was a certain number of children that really we knew needed our services. Advancing spatial science and predictive analytics to help physicians like Dr. Misra and her team reach the people who need them most. For Science Nation, I'm Miles O'Brien.